A hearty good afternoon and welcome to a session on common challenges of a breastfeeding mother. We're glad to have Dr. Seema Sharma among us today to help us understand the topic. Breastfeeding is one of the most important functions of a new mother, and it's a primary process to deliver nutrition to a newborn baby. It is one of the most important activities in the life of a child and mother. And the doctor will help us understand breastfeeding better by helping us understand issues faced by a new mother and from the point of view of the new mother. So, doctor, you have the stage.
Good evening, everyone. I'm Dr. Seema Sharma, as already told to the audience. And today I'm a senior consultant ops and gynae from Apollo Cradle, Amritsar. Uh, I have come up with another FB live session on challenges of breastfeeding. As we know, breastfeeding is like a different experience for every mother, and uh, it has lots of ups and downs during the this phase, and especially in the beginning there are a lot of downs than ups because it takes little patience and tolerance to ha- give breastfeeding to the baby. So today I'll be discussing the challenges of breastfeeding. So whenever a new mother comes to us, they have a few questions, queries in the on the very first day. When we encourage them to put the baby for breastfeeding. They have for the first question that comes to us that I don't have enough milk to feed my baby, and baby remains hungry. So that is the first challenge they face. Low milk supply is the first challenge, and to this is to some extent is true because most of the first time mothers they face this problem, and there is less milk or negligible milk supply in the first 3 days. But important thing is that every mother should be counseled that they should encourage breastfeeding, and early skin to skin contact of baby with the mother is very important, and early initiation of breastfeeding is also very important within 1 hour of birth of newborn. The skin to skin contact that helps in the emotional and physical binding of the both mother and baby, and more important is that the baby maintains the body temperature and hypothermia is not there. So because of emotional and physical binding, the mother also feels confident, and breast supply milk supply is established soon after that. So it is very important for the early initiation of breastfeeding, and for it is very important that milk supply is increased. The more we suckle the baby, more these are milk letdown reflex is there. So it is very important to put the baby on breastfeeding, and every time baby is hungry, mother has to do the effort for the breastfeeding. And as a whole, like in 24 hours, at least 2 to 3 hours of breastfeeding time should be there, so that as the baby suckles, the milk letdown reflex will set in and milk supply will increase. So by third day, almost all mothers they start having the milk letdown reflex, and they can feed their baby. But even if they have 1 or 2 drops of milk in the first 3 days, that is the first breast milk, which is called colostrum. It is very important for the baby to get that colostrum because it is full of protective antibodies and nutrients which are important for the baby, and they are very good for the baby. They protect the baby from various diseases. So milk will eventually increase, and it increases so much that then they are fed up that there is oversupply of the milk. So, but some of the mothers actually have some definite issues that they don't have enough supply. It can be because of obesity. Some mothers have hormonal imbalances and milk supply is less. And some of the mothers they have different issues that their milk supply is less, but then they have to seek the help of a lactation consultant or their doctor to take the help for that matter. uh, this is regarding the first few days. Then after a month also, some of the mothers are panicky and anxious whether my baby is getting enough milk or not. We are not sure because breasts are not like full, they are soft, and the baby sucks only for 5 minutes and all. So that is also very frequent question after a month. But they must understand that after the baby is like they start growing, they are actually expert and taking the breastfeeding, and they extract the milk quickly, and 5 minutes of feeding is enough at each breast at that time. And once the baby extracts the milk fully, the breast remains soft. It doesn't mean that babies are hungry. And every mother has to keep a check on their diapers and for their urination and passage of stool. If the baby is passing enough of urine and stool frequent, 6 to 7 type of stools every day, it means they are properly hydrated and they are getting proper nutrition. But in case of doubt, if baby they feel their baby is not growing, they can take the help of neonatologist, and it is for the doctor to see, baby's doctor to see whether they are taking proper feed or not, because then only they will know how's the baby's weight gain and growth is. And if there is a problem, then neonatologist will only guide about the proper feeding and all. So uh, after a few in sometimes babies they take a lot of time in feeding, and that is in between the growth spurts. When there is growth spurt of the baby, they spend more time on feeding. They can take 45 minutes, 1 hour. So that is just a cluster feeding type of pattern. And and that time they can increase their feeding time, but normally baby takes 5 to 10 minutes to extract the milk. The second challenge which we normally face and mothers face is once the milk supply is there and everything is there, the common complaint is the nipples are becoming sore. Normally they are soft and moist type of nipples, but sometimes because of faulty technique of feeding, the nipple becomes sore, they become tender. So uh, that is they they need counseling for that, because it is the faulty technique, because the baby is just feeding on the nipple. Have to be counseled. The whole areola, that is the dark portion around the nipple, has to be taken in. So good latch is the key for not having the sore nipples. But if the sore nipple, they we have to look for the other reasons also. Sometimes there is engorgement of breast, and that leads to sore nipple and flat nipple, tender nipple. So we have to see whether breasts are normally full or they are engorged or they're plugged ducts. So these factors also we have to rule out. And proper feeding positions and latching positions have to be told to the mothers. And if cracked nipple still persists, we have to look for the fungal infections of the nipple also, whether the sore nipple are because of fungal infection, because sometimes the milk supply, there is oversupply of milk from the mother, and the nipple, they keep the nursing pads over the nipples, and they keep the nipples all the time, they are moist and they can catch fungal infections. And sometimes baby's mouth is not cleaned properly and they have thrush in the mouth, and that is transferred to the mother's nipple. So that is also one reason of sore nipple. So one is how to then tackle this problem. uh, if it is a faulty technique, you have to, every mother has to learn about the technique of feeding. Then keep the nipples clean and dry, that is very important. But they should be they should be kept moist also at the same time, by rubbing the same milk, the hind milk, which we tell the mothers to apply hind milk after feeding the baby over the nipples. Nipple should be cleaned only twice or thrice a day with the plain water. No hard soaps or liquid gels should be applied. And other than milk, application of their own milk, which has healing tendency for the sore nipples, they can apply coconut, good quality coconut oil, or some purified lenonil jellies, nip care creams. That is also sometimes helpful. but that is all they have to take care. But if it is very very tender, don't put nipple shields or other things over the nipple, and but give rest for a day to the that side of the breast, and they can extract milk and give rest to the baby, that side, and then again they can start feeding from that side after a day or so. And don't put the tight fitting undergarments that can press the nipple and they can hurt the nipple. So this is all about sore nipples. They can give cold compresses also to the nipple to relieve the pain. Then comes the problem of oversupply of the milk. There is lot of supply of the milk, and it starts leaking, and sometimes it doesn't leak and it leads to engorgement of breast. Normally the during the feeding phase, normally the breasts are little heavy and full, and but they are not painful. But if it becomes uh, hard and they are full and they become painful, it means the feeding is either the supply is more or feeding is less, or feeding technique is faulty and baby is not getting the proper feed. So it leads to collection of milk in the uh, ducts, and it leads to engorgement of breast, which is very painful, and it leads to tender sore nipples and flat nipples, and baby altogether stops feeding from that breast. So you just take care. If it is the mother is getting more milk, so it has to be extracted after feeding, before feeding, so that it becomes little soft and baby takes a proper feed. And after feeding also, if there is milk still coming out and still hard, it has to be pumped out. And by it has to give a mother needs to give hot compresses and soften the breast and little massage to the breast and take out the milk. If it is very very tender and painful, then cold compresses can be given to the breast to relieve pain. But it needs to take care that milk should be extracted completely, and it should be baby should be fed regularly after 1.5 hours or 2 hours on that breast, so that milk doesn't collect. So that is all about engorgement of breast. And this engorgement generally occurs from third to fifth day, then when the milk supply suddenly increases. So this is all about engorgement. Then it can lead to plugged ducts. Plugged duct is because of the that there is a collection of milk in the in the one of the ducts, and that milk is because of faulty technique or whatever. So it is not milk is not transferred from mother's breast to the baby, and the opening of the duct that gets plugged, and it leads to collection, and later it can collect and becomes very tender lump like thing, and which can later on lead to mastitis or sometimes abscess formation if it is not taken care of. So best thing is to seek the help of a lactation counselor and or the doctor, so that they can tell them to give uh, to give the feed in a proper manner. So lady has to give a massage to that duct and transfer the milk from upper to the upper side towards the nipple side, and so that milk doesn't collect in that particular duct, and it has to be taken care of. Other challenges can be fungal infection. I've already spoken that fungal infection is because of unhygienic conditions. Sometimes nipples are not properly cleaned, or it is kept moist all the time because of oversupply and nursing pads which are not changed frequently. It leads to fungal infection, and they become red and they become cracked, and it has to be shown to the doctor, so that, and it has to be kept dry all the time, and with just with the nip care creams and all, and keep kept moist, and that from that side it is like one can stop feeding from that side, so that uh, after that once the fungal infection is completely cured, and you have to extract milk from that breast regularly, so that doesn't lead to engorgement of that breast. So another problem we face in the beginning is like inverted or flat nipples. Some of the mothers, they don't see their nipples during pregnancy, and once the feeding has to be started, the nipples are not proper. So every time then a baby, they try breastfeeding, a baby doesn't feed on that inverted nipple, but mother has to take care that nipple has to be pulled outside every time she has to feed. And after, once the baby starts feeding, it automatically comes out. But if there is some problem, some of the lactation consultant, they can take the help of certain devices or syringes to pull out the nipples by suction mechanism. So this problem can be sorted out, and but they need, mothers need a regular effort for this. They just if they don't put the effort, it can lead to engorgement, and ultimately breast milk stops coming only from that side. And some of the other breast size, nipple, they also are few challenges, that sometimes the size of the breast is not compatible with the baby's mouth, and they especially the nipple size also. But then with regular effort, the baby starts feeding from all those nipples. But you need to put some effort for the first week of after delivery, so that baby gets little practice, and you also are trained for that for breastfeeding. Another challenge we generally face is that baby almost feeding on the breast for 1 2 months, it suddenly starts refusing the breastfeeding. This is also one problem, and it is known as nursing strike. Baby is well fed earlier, but suddenly it stops feeding. It can be because generally the mothers, they introduce bottle feeding, formula feeding to the baby with the bottles, and the nipple they use for the bottle, and the baby gets confusion, nipple confusion of mother's nipple and bottle nipple, and they prefer bottle feeding because it's easier, and they suddenly refuse. But whenever baby is having this nursing strike, one has to look for the cause. It can be just because formula feeding has been added, or it can be the other causes also, that baby has some ear infection or ear pain. Baby is not comfortable in that position you feed, and gets some pain in that position. Baby's clothes are not proper, they are tight clothes, you are feeding the baby with tight clothes or over clothed babies, they are not comfortable, and they start refusing the feed. So you have to look for other reasons, that why the baby is not taking feeds, and you have to seek the uh, consultation of an expert. So these are some of the challenges uh, uh, mother feels during this breastfeeding phase, and every mother has a different experience. And after I think 1 or 2 months, every mother is comfortable feeding, and once the baby starts taking proper feeds from the mother, is very easy, because it's a ready-made milk, and it is the best milk. Exclusive breastfeeding is the best feeding for the baby for first 6 months. No extra feeds are required, no formula, no formation required, and it's a ready-made milk and best for the baby. And so it has to be encouraged, uh, and but you need the help of expert and counselor that's there. So and I think it needs lot of patience and tolerance, and it is very important when to seek the help of an expert in case of any challenge they are facing. Thank you for the patient listening. If from the audience there's any question, they are most welcome to ask. Transcribe. This since there is no question, we are ending the session.